Morning, Mr. Lampe.
California Rehab Institute is the premier inpatient hospital for recovery and rehabilitation after injury or illness in Los Angeles. It's a joint venture between UCLA Health and Cedars-Sinai. It allows us to tap into the very best minds and research to improve our patients' recovery.
Are you feeling stronger after therapies?
Yes, the therapies help very much.
We treat patients who have had stroke, traumatic brain injuries, spinal cord injuries, and a variety of other neurological conditions, as well as patients who have had orthopedic surgery, trauma, and medical conditions.
Cal Rehab has done a tremendous job with me. While I was hiking with my friends, I was helping somebody, a friend of mine, and I fall down 400 feet down to the cliff of the mountain.
You have your belt strapped on.
I don't have movement on my legs. I have limited movement on my arms. The therapists, their attitude, their dedication towards the patient was something amazing. They are excellent. I still feel them like a family.
I know you're going back in a few months, right?
They want me to improve, and that's one thing that I like about them a lot.
We bring together professionals, physical therapists, nurses, occupational therapists, speech therapists, as well as physicians. And we work together. We look at the patient and we determine what individual treatment needs they have to optimize their recovery and get them home. At Cal Rehab Institute, we have 138 private rooms, and we're close to both UCLA Medical Center and Cedars-Sinai Hospital. We are dedicated here towards having the best of technology that will help patients' recovery. Whether that's a body-weighted support, treadmill training, whether that's computerized, repetitive, task-specific training, or some other device, we use those as they're needed. On the other hand, we also have very personal, person-to-person, human touch in getting patients mobilized. Both of those are important in rehabilitation.
There you go.
California Rehab Institute was new. It's kind of cutting edge. And it was really built for what I was going through. I had suffered an aortic dissection, and as a complication of the surgery was the loss of my lower extremities and fingers on my right hand.
Good, and really putting weight on your legs.
My therapist really got it and understood what my needs were, and we communicated very well. The other choices in Southern California were really pale by comparison, whether it be the physicality of the building, the equipment, and the know-how of the therapists and doctors. This was the premier choice in Southern California for rehabilitation, and I think it always will be. Learning how to walk was my #1 goal. By the time I left,
too big of a step.
You know, we had strengthened my core. I had learned how to walk unassisted.
Good job, Clint. Sucking that belly in.
I made it about 2 weeks ahead of time.
What really gives me great joy is to be able to treat patients with complex conditions in the best that we're able to do in a beautiful facility with a fantastic team approach to allow them to make the best recovery they can from sometimes devastating illness or injury.
They always tell me, don't say no. You say, you will try and you will succeed. Cal Rehab was the best choice for me.
Fake hug.
Be good. Keep it down. Keep picking on you.
I love it.
See you. Be good. You look good.
Cal Rehab was definitely the right choice for me.
Take the first and most important step in your recovery. Ask to speak to our liaisons or contact the admissions office.